Hey everyone, and welcome to This Explainer. Today, we're diving into a massive, yet surprisingly overlooked burden on global health. We're going to be looking at this specifically through the lens of Nepal, focusing on lower limb conditions. We're talking about conditions that literally strip away a person's mobility, their livelihood, and their independence. But what is truly fascinating about this, and what we're really going to unpack today, is how this crisis is actually being tackled. We're exploring two distinct pathways being used to treat it right now, one grounded in modern biomechanics and the other rooted in ancient Ayurvedic traditions.
Let me ask you something right off the bat. What keeps an entire nation from moving? Because mobility is the absolute foundation of a nation's livelihood. Think about a country like Nepal. It's characterized by this incredibly diverse, rugged geography, right? You've got the sweeping southern plains, the rolling hills, and of course the towering Himalayan mountains. In an environment where navigating difficult terrain is just a daily necessity for agriculture, for commerce, or even just simple survival, losing the ability to walk freely isn't just a minor inconvenience. It's a completely life-altering event.
So, here is our roadmap for today. First, we'll uncover the hidden joint epidemic. Then we'll look at the cost of knee pain. After that, we'll explore moving to heal, followed by the Ayurvedic approach, and finally, we'll wrap up with a holistic way forward.
All right, let's jump straight into part one, the hidden joint epidemic.
To really grasp the solutions we're going to look at later, we first have to understand the sheer scale of the problem. A recent cross-sectional survey published in the Journal of Global Health actually went out into communities across Nepal's plains, hills, and mountains to find out just how widespread these mobility issues really are. And what they found is absolutely wild. 26.6%. Over a quarter of all the households surveyed reported having at least one member suffering from a lower limb condition. If you just look at the adult population individually, over 11% are actively dealing with these issues right now. So this isn't some rare, isolated medical anomaly, This is a widespread, everyday reality for millions of people.
Now, what's really interesting is where exactly that pain is located. Out of everyone reporting a lower limb condition, an overwhelming 74.2% pinpointed their pain right at the knee. That huge number zeroes our focus directly onto osteoarthritis. That's a degenerative joint disease where the cartilage gradually breaks down, which eventually leads to really painful bone-on-bone contact. The knee is bearing the absolute brunt of this epidemic.
Which brings us to section 2, the cost of knee pain. So we have the clinical data, but what is the human and socioeconomic toll here? What actually happens when a population that relies on physical labor and mobility can no longer even bend their knees without excruciating pain? The impact is devastating. A massive 82% of the folks experiencing lower limb pain reported that it severely or extremely restricts their daily activities. Imagine trying to farm terraced hillsides or simply walk to a local market on steep, uneven ground when every single step sends a shock of pain right through your body. This level of restriction fundamentally alters how a person lives and participates in their community.
And nothing paints that picture clearer than this one specific finding. Over 70% of individuals who listed household chores as their primary occupation stated they were only doing that because they literally had been forced to give up their actual work due to their lower limb condition. Knee pain isn't just an ache, it is an economic wrecking ball. It is actively forcing people into unemployment and stripping them of their primary livelihoods.
So, how do we fight back? Let's get into section 3, moving to heal. How do we fix this? We're going to look at this through two completely different lenses, starting with the modern biomechanical and physiotherapeutic approach. This is the kind of evidence-based practice you'd see at places like the Manual Therapy Hospital in Nepal. Now, for a long time, the traditional fix was basically just throwing pain meds or long-term NSAIDs a problem. But we know relying on those carries some pretty nasty gastric, kidney, and cardiovascular risks. Plus, they only mask the pain. The manual therapy approach flips the script entirely. The current scientific consensus points straight to exercise and joint mobilization. Instead of masking the pain, this approach treats the underlying dysfunction by strengthening the muscles around the joint to physically reduce the load it bears. But it's not just about exercise. They're also tapping into some really innovative regenerative treatments, like platelet-rich plasma, or PRP therapy. This is a fascinating alternative to old-school cortisone injections. In just 30 to 45 minutes, doctors draw a small amount of the patient's own blood, process it to concentrate the platelets and growth factors, and inject it right back into the arthritic joint. It literally stimulates your body's own cartilage repair and reduces inflammation naturally. And what I love about this approach is how much power it gives back to the patient for daily management.
Check out this math, because this blew my mind. Dropping just 1 single kilogram of body weight removes 4 kilograms of load off your knee joint. That is a profound biomechanical payoff. Combine that with staying active to keep the joints lubricated, using heat and cold therapy, and getting proper sleep to manage inflammation, and patients can drastically improve their quality of life right from their own homes. Okay, let's switch gears to our second lens in Section 4, the Ayurvedic approach. So, how does traditional Eastern medicine, a system practiced for thousands of years, tackle this exact same biomechanical crisis? Well, in Ayurveda, osteoarthritis of the knee is known as Janu Sandhikatava. Ayurveda views health as a delicate balance of bodily systems, or doshas. This specific condition is seen as an imbalance or vitiation of the Vata dosha, which is the energy that governs movement and is heavily associated with dryness. This imbalance essentially leads to a depletion of osteodhatu, or bone tissue. So while a Western doc might see worn-out cartilage, an Ayurvedic practitioner sees increased dryness, roughness, and channel obstruction in the joints that desperately needs to be nourished and lubricated. To put this to the test, researchers ran a clinical trial in Nepal with 45 patients diagnosed with Janu Sandhikatavata. They split them into 3 groups to see what worked best. Group A got Vyoshadi Gugulu, which is an oral herbal medication famous for its anti-inflammatory properties. Group B received Tiktik Shirabasti, a specialized medicated enema designed to pacify that dry Vata energy and systemically nourish the bone tissue. And Group C? They got a combination of both therapies. The results? Honestly, they're pretty incredible. They measured outcomes using the WOMAC index for pain, stiffness, and physical function. Group A saw a really solid 61.5% improvement. Group B saw 58%. But look at Group C, the combination group. They experienced a massive 78.5% improvement in their symptoms. They felt pain relief earlier, had sustained reduction in stiffness, and get this, it was all with 0 adverse side effects to their renal or hematological systems.
Which leads us to our final takeaway in Section 5, a holistic way forward.
We've just looked at the cold, hard data of the epidemic, the targeted physical therapies of modern science, and the systemic balancing of Ayurveda. And you know what's truly striking? When you put them side by side, despite using completely different vocabularies, one talking about platelet-rich plasma and quadriceps loading, and the other talking about pacifying Vata dosha and nourishing osteodhatu, their end goals are exactly the same. Both approaches recognize that just masking pain with pills is a total dead end. Both seek to treat the root cause, whether you call it a biomechanical dysfunction or a systemic imbalance, to restore movement and actually give people their lives back.
So I leave you with this to chew on. When 82% of people dealing with lower limb pain are severely restricted from just living their everyday lives, we obviously need every single effective tool in the toolbox. How might Western biomechanics and Eastern Ayurvedic traditions coexist to solve our greatest global health challenges? Imagine a future of integrated medicine, where the absolute best of both worlds work in harmony to keep the nation and the whole world moving. Thanks for hanging out with me for this explainer, and keep asking those big questions.